Here, I'm going to discuss few question and answer from psychosocial integrity. It is very important for NCLEX exam. The first question here, a client on the behavioral health unit and tell a nurse that she was raped 5 months earlier. And during the nursing assessment of the client's sleep pattern, the client complained having the difficulties of falling asleep and also staying asleep. She attributed her irritabilities to sleep deprivation. Further questionnaire relevant that the client cannot recall details of the rape and feeling detect when she had sex with her husband. The nurse recognized that this client is experiencing symptoms of what disorder, right? So this question talking about the sexual assault. So first of all, answer is we have to choose. But if I say means what is sexual assault? Means forcefully sexual contact is the way to explain. And it is a crime, right? It's a crime of violence or the crime of aggression and power. And keep this note, majority of the peoples are known to the victims. Majority of person who is victimized, they known before to the person. Alcohol or other drugs are often associated with sexual assault. So about the sexual assault, rape is one of them. We call rape trauma syndrome. So usually response to the sexual assault that can include sometimes the person who have a history like this question, they express their reaction like crying, anger, or control the reaction like confusion or numbness of feelings. Sometimes somatic reaction means physical manifestations such as headache, muscle tension, GI manifestation, or genitourinary manifestation, right? So as a healthcare provider, it is very important to nursing care of the patient who have it, right? So if the patient come to you like this, we provide for the patient safety. We administer some prophylactic treatment for sexual transmitted infection or administer emergency contraceptive pill for pregnancy risks. Also, it is very important to provide 24-hour hotline for rape survivor, right? So whatever it is, they said the nurse recognized that the client is experiencing symptoms for what disorder? Antisocial personality disorder, right? It is not a question about the antisocial personality disorder. Or is it for cryptridophobia or ehedophobia? It is not a phobia. The patient, the occurrences have already happened, and 5 months ago, still patient facing some problem. So after the trauma, patient carry on the problem, disorder. So it is called post-traumatic stress disorder, right? So post-traumatic stress disorder is characterized by a pattern of symptoms resulting from exposure to a traumatic events had happened 5 months ago with this patient. These symptoms last more than a month, right? And distinguishing this client disorder from acute stress disorder, which resolve within a month. Common symptoms of PTSD include intense fear, helplessness, horror related to the trauma, recurrence or disturbing recollection or dreams of the trauma. So post-traumatic stress disorder exposed to the traumatic events, particularly. Not only the case like this, rape, sometimes physical abuse, military combat, also post-traumatic stress disorder. Usually patient complain of flashback or distressing dream, difficult of concentration, insomnia, anxiety, irritabilities, or detachment from others, like the feel detached when she had sex with husband, or feeling of guilty or negative self-image, very common, the person who have post-traumatic stress disorder. So if you ask me, what are the treatment options for them? Cognitive behavioral therapy is very effective, or prolonged exposure therapy, like combined with relaxation techniques, it works. Or some medication, if anything not work, like SSRI or tricyclic antidepressant can work. So let me read the next. So symptoms of aerosols such as difficulty of falling or staying asleep, irritabilities, and exaggerated startle response. Client with antisocial personality. Why it is not an answer? Disorder show the little concern for others or no moral standard. So another word is called ahedonia, typically of depression, and is defined as the inability to derive the pleasure from act that ordinarily produce the pleasure. Next question here. A nurse is obtaining the health history of a client, and those background differ from her own, and develop actually acceptable strategies for nursing care. The nurse should assessment which client factor. So this is the personality disorder. So if anybody come to us with personality disorder, it is very important to find out some underlying, find out the history. And it is important to care of them. So they said the nurse should assessment which factor, marital status, cultural influences, financial resources, and community involvement. Therefore, all is important, but most important here is a cultural influence, right? Because culture in awareness is related to our mental health or personality disorder. So they said assessment, the client cultural influences help the nurse identify behavior she should take into account when planning his care. So nursing care is very important in case of personality disorder patient. So although the nurse also must consider the client marital status, their financial condition, or community involvement when planning care and rehabilitation. This factor have a little relevance when she is formulating the cultural acceptable strategies for nursing care. So if patient like this, when we provide or when we think about the planning nursing care, we must provide safety for the patient at the risk for self-injury or any kind of violence. And we provide limited and consistency. We provide the training for dependents, and also we respect the need for the patient. Next here, the nurse is instructing a new group of mental health, right? Mental health aides. The nurse should teach the aides that sitting limit is the most important for. So group therapy or setting limit is very important for mental health nursing, right? But question here, there are 4 options who need limited setting limit, or setting limit is the most important for whom? A depressed client, a manic client, or suicidal client, or anxiety client. So first of all, it is very important every patient for assessment anxiety, right? If we get them any anxiety patient, we find it out what the level of anxiety, then we provide the nursing care. If the suicidal patient or client, first important, the safety is first priorities, right? Safety, I said. We also, suicidal, we provide one-to-one constant supervision. Also, do not place the patient in a private room if the suicide. So who are the depressive? It is very important to find out what are the cause of depression, right? So in case of depressive patient, our care should be, priority care is depressive, I said. Assessment the patient suicidal risks. And also it is good to provide one-to-one observation. And we do not provide the private room who is depressed. And communication with the simple sentence. And we provide the medication. Whatever the set limit in this question, usually patients who are the manic, like bipolar disorder patient, Sometimes they are manic, sometimes they are depressed. So mood disorder with recurrent episode of mania or depression, we call bipolar. So bipolar patients have a manic phase, particularly manic client. Mania means excessive, elevated the mood, right? So in these cases, we need to take care of our patient. So the set limit we could provide who is manic patient. Also, we provide safety first, provide the safety environment, protect your patient from poor judgment, giving away money or sexual misdirection. Also decrease stimulus. One-to-one observation is very good for them. Or provide the frequent rest period. We monitor for the sleep, fluid and food intake. Also, it is very important, many patients provide high calorie or portable snacks. And set limit. This question is super important, and give constant explanation and use a claim approach. Very important. Set limit for unacceptable behavior is most important in a manic client. In general, depressed, anxiety, anxious, suicide client do not physically or mentally test for limit for a caregiver. Next question here. Touching other people without their permission and reading someone else's mail or using personal possessions without asking the permission, all example of antisocial, manipulation, poor boundaries, or passive aggressive behavior, right? So here it is, as I told you, this is the personality disorder, right? So in that, if anybody have this nature, what we could do, so they said it is the poor boundaries. So that described behavior indicate poor personal boundaries, which is the inability to differentiate between self and others. Poor boundaries are the symptoms of antisocial and passive aggressive behavior as well, right? So next question. When developing a care plan for a hospitalized child, the nurse knows that the children in which age group are most likely to view illness as a punishment for misleading. So infant, right? So if anybody is infant, means extremely young, in that they do not think about this. Like in infant, they go for the bubbling, reflex stimuli, holding the neck. This will check. And preschooler, they like to imaginary thinking, right? Preschooler, I said. School age group or adolescents, this is totally, they like this very competitive, this age group, highly competitive. So the preschooler, they think about this. So preschooler age children are most likely to view illness as a punishment for misdeed. Separation anxiety, although seen in all age group, is most common in older infant. Fear of death is typical of older school-age children and adolescents. So adolescence means like 12 to 18 years. In this age group, they like internalization, we call teenager group. And adolescents also peer associate and self-development is important. And school age, particularly, they like to fair play or justice play, because as I said, this age group is highly competitive. But preschooler or school age group, they like associate play. Next question. The client on behavioral health unit tell a nurse that she experienced palpitation, trembling, or nausea while traveling alone. So traveling alone outside her home. And these symptoms have severely limited the client's ability to function and have caused her to avoid the living home whenever possible. The nurse recognized that this client has symptoms for what disorder. So this patient has a phobia, right? There are different types of phobia, basically. But this person has a phobia with some physical sign symptom like palpitation, trembling, nausea. So this is very common in agoraphobia. What is agoraphobia? This is the abnormal fear of open space or being alone in public places. And the patient who have agoraphobia, the patient may refuse to leave home and also result in the panic attack. What else? What are the other keyword is meaning? Let me read it. Agoraphobia is a phobia or a fear or avoidance of open space accompanied by concern that escape to safety would be difficult. Agoraphobia is commonly accompanied by physical symptoms like palpitation, trembling, nausea, and shortness of breath. It is also commonly accompanied or preceded by panic attack. What the other keyword? Thanatophobia is the fear of death. Aerophobia, the fear of air, but no sign symptom, physical sign symptom. And hordophobia, the fear of traveling. Next question. A client with paranoid personality disorder, right? So, and then disorder admitted to psychiatric unit. So, which remark by the nurse would best establish rapport and encourage the client to confide in her. So the examiner made this question easier because diagnosis is the paranoid personality disorder. So paranoid means distrust or suspiciousness of others. So if the patient have paranoia personality disorder, when as a healthcare provider, when you interact with them, out of 4, which is the best one? Encouraging the client to confide. So it is important make a trustable relationship with the patient, right? So I get upset once in a while too. I know just how you feel. I do feel the same way in your situation. I worried too when I think people are talking about me. At the time, it is the normal, not the trust anyone. So definitely the patient have a distrust. If number 4, you said you means you encouraging the patient false perception or false belief, right? So we do not encouraging anything what is not true, right? Because psychiatric patients sometimes come with false fixed belief or misperception of stimuli or sensory perception, right? But we do not encouraging them. So number 4 is not answer. I worry too. I have thinking means you are agree with patient's problem. So I know just how you feel. I do feel same. So it is also not correct. Then it is encouraging as well. Number 1, I get upset once in a while too. So it means you little bit agree, but you have to say something more for your patient. So you can sharing a benign, non-threatening or personal fact or feeling helps the nurse establish the rapport with the client or encouraging the client to confide in her. Why you are approaching like this? Because you are going to make a trustable relationship. You like to remove the suspiciousness from your patient to others. So the nurse cannot know how the client feels, and telling the client otherwise would satisfy suspiciousness of a paranoid client. And I said paranoid personality disorder, misdistrust, and suspiciousness of others. So the client relies on the nurse to interpret the reality. The nurse starting that she worried, and when people talk about her incorrect because the statement focus on the nurse feelings, not the clients, and saying it is normal not to trust anyone would not help and would not help to establish rapport, encouraging the client to confide in the nurse. Next question. A client in a group therapy and setting is very demanding, and he repeatedly interrupts others and also monopolized most of the group times. The nurse's best response would be, so group therapy is very important, particularly behavioral therapies, right? So when we go for a group therapy, we have to set up the goal of the group therapy. So allowing the members to share the common feelings and experience, and also learn alternative way to solve the problem. This is the goal of group therapy. But if we see some clients are silent, or we will see sometimes some member constantly talk and some member never talk. Some member easily get angry or irritated. So as a healthcare provider, we have to know how to deal with them. So who are silent, it is good, drive the group into pairs to discuss the topic, and then summarize the discussion to the groups. The member who talk too much, constantly talking, asks the group to discuss their feelings regarding the members' monopolizing behavior. And who is easily get angry or agitated member, move the group members away from the member to prevent the injuries. Very important. So in this case, the nurse best response who repeatedly interrupt others and monopolized. So will you briefly summarize your point? Other also need time. Your behavior is obnoxious and drain the groups. I'm so frustrated by your behavior. To ignore the behavior and allow him to vent. So there are 4 options. Definitely you choose number 1, because by this patient can verbalize their feelings, right? They can share their experience. And others is not okay, because I'm so frustrated. You are the person who dealing with the mental health problem patient, and if you are frustrated, who give them leadership? You are the person who tell and correct the behavior problems, like you do modeling or you systemic desensitization or aversion therapy. It is everything a nurse can do for the patient. So asking the client to summarize is direct the client to focus his comments and allowing him to make his point if he or she has. Saying the client behavior is obnoxious is judgmental. So you can't say this. You can't go for the judgment or can't go for your personal anger or hesitant behavior. Telling the client that his behavior is frustrating does not facilitate communication. It is not a therapeutic way of communication. So it is very important when you deal with the patient, how you deal with them, right? So we approach everything very professional way, and therapeutic way of communication is important, right? When you talk to the patient, it is important you asking open-ended question and maintain eye-to-eye contact to convey the interest. Sitting or standing at eye level for therapeutic touch to convey caring and provide the comfortness. And also we try to minimize the distraction or discuss the health in private setting. And always try to keep your face the patient when speaking and use a low speech volume of voice. It is very important therapeutic way of communicate with your patient. Next question. A nurse is obtaining a history from a client. The client report that he is a waiter. When asking the question here, asking about his work environment, the client said, if customers confront me for not being attentive enough, I just spit on their food. The nurse suspects the client is prone to which type of behavior. So this is the question about the patient, about the personality disorder. We have a different kind of personality disorder like paranoid, schizophrenia, or schizotypal, antisocial, borderline, or narcissistics, avoidance, dependence, and obsessive compulsiveness. So here said, this behavior example of obsessive compulsive. So if the patient has an obsessive compulsiveness, the focus on perfection, right, or order and control that may prevent the patient from complaining a task. If patient has a narcissistics, they're very arrogant and need for constant admiration or lack of empathy towards the others, right? And dependence means sometimes some patient extremely dependency in a close relationship and they need excessive input from others to make a decision. So the patient said, if the customer confront me for not being attentive enough, I just spit on their food. It is the example of passive aggressive. What does it mean, passive aggressive? Let me read it. This client exhibit a negative attitude and passive aggressive behavior in response to word demand for adequate performance. Clients who are passive aggressive would not confront or discuss the issue with others, but will go to the great length to get even. Obsessive compulsive behavior involves some rituals or rules that interfere with normal functioning. A person with a narcissistic personality has exaggerated sense of self-worth. As I told you, they're arrogant and they need for constant admiration and they have a lack of empathy towards the others. A person with a dependence personality is submissive and frequently they go for apology and back down when confronted. Next question here. A nurse is preparing a client for chemotherapy to treat the colon cancer. The client say, I do not know about the treatment. After everything is said and done, it may not do a bit good. This thing may get me anyway. Which response by the nurse is the most therapeutic? So it is the way of therapeutic communication, right? So during the dealing with the patient with therapeutic communication, we go for reflecting or paraphrasing, exploring, right? So question one, you are wonder when whether you have made the right decision about your treatment. So the patient already make their decision, they made it. So you reflecting or paraphrasing, it is also way of communication. Many people beat the cancer. It is actually a little bit advised or justifiable. Colon cancer can now be cured in many cases. Everyone who has cancer worried, but you have even reason to be hopeful. So what patient make the decision, you just paraphrase it or reflecting. You are wondering whether you have made the right decision about the treatment. So by rephrasing, I said, or paraphrasing. So what is paraphrasing? Paraphrasing means restate the patient feelings to confirm understanding of what patient is saying. And reflecting means the return the focus back to the patient. And restarting means repeat the patient accurate word. And sometimes we need to exploring. And exploring means gathering more information about something patient has mentioned. And general leads, sometimes we need general leads, means allowing the patient to guide the decision. So the client statement and focus on his concern, the nurse encouraging further decision of his feelings, and telling the client to keep positive attitude incorrectly impulse that the nurse know the best way to deal with the situation, saying that the cancer of the colon may be cured, ignore the client feelings, monitor that everyone who has cancer already disregard the uniqueness of the client and feelings of impulse that is concerned and are not acceptable.